Plasmapharesis and plasma exchange. Plasmapharesis is the process healthcare providers use to obtain plasma from blood. Plasmapharesis is often done to remove extra antibodies, abnormal proteins, or other harmful substances from the blood. It may be used to treat certain types of blood disorders, autoimmune disorders, nervous system disorders, or other conditions. Plasmapharesis also can refer to the plasma donation process, where the plasma is removed and the blood cells are returned to your body. Plasma exchange is when providers use plasmapharesis to replace someone's plasma. They do that by taking blood and using a machine to separate the plasma from blood. Then, they replace the plasma with fluid, add the replacement fluid to the blood and return the blood to the person receiving treatment. Procedure is slow and may take several hours to complete. The preferred method of plasmapharesis in most centers is by automated centrifuge-based technology. However, in certain hospitals and patients on hemodialysis, plasmapharesis is done using membrane plasma separation. In plasmapharesis using centrifugation, filtered plasma is discarded, and RBCs and replacement fluid, donor plasma or colloids, are returned. Membrane plasma separation allows selective removal of undesired macromolecules. Hence, filtered, processed plasma is returned to the patient, eliminating the need for replacement fluids. Therapeutic plasmapharesis is used for numerous diseases, autoimmune disorders, Guillain-Barré syndrome, myasthenia gravis, and lupus, neurological disorders, multiple sclerosis and certain neuropathies, acute liver failure, hypertriglyceridemic pancreatitis, blood disorders, thrombotic thrombocytopenic purpura, TTP, and hyperviscosity syndromes, kidney diseases, Goodpasture's syndrome and certain types of glomerulonephritis. Equipment used: cell separator machine, IV catheter, replacement fluids, monitoring devices. Procedure preparation. The patient is typically positioned comfortably, and intravenous IV access is established. Blood collection. Blood is drawn from the patient and passed through a machine. Plasma separation. The machine separates the plasma from the blood cells. Replacement. The removed plasma is replaced with a substitute solution, such as saline, albumin, or donor plasma. Reinfusion. The treated blood is returned to the patient's body. Plasmapharesis is contraindicated in the following patients: patients who cannot tolerate central line placement, patients who are in an actively septic state or are hemodynamically unstable, patients who have allergies to fresh frozen plasma, FFP, or albumin, depending on the type of plasma exchange. Plasmapharesis can carry the following risks: infection. Most procedures involving transfer of blood into or out of the body carry a risk of infection. Blood clotting. Allergic reaction. This is typically a reaction to the solutions used to replace plasma. Complication prevention. Pre-medication with diphenhydramine and hydrocortisone are often given if the patient is to receive any blood product, including priming the tubing with packed RBCs, in particular if a history exists of prior reaction to blood product.